Today, the World Health Organization declared COVID-19 a pandemic, and yet people still have their heads in the sand saying things like, oh, it's less dangerous than the flu. To this retort, a doctor in Italy responded a few days ago. Patients have far from the complications of a flu. Let's stop saying it's a bad flu. Tell me which flu virus causes such a rapid tragedy. Let's be clear, the coronavirus is a pandemic growing at an exponential speed, meaning it's slow at first, and then suddenly it's overwhelming hospitals in the blink of an eye. You may have days, maybe a few weeks, until the healthcare system in your area is overwhelmed, and there won't be enough beds. People will be treated in the hallways, and some people won't be treated at all. Doctors in Italy currently have to choose who to treat, depending on their chance of survival. Doctors and nurses there no longer have shifts or schedules or departments. Instead, it's all hands on deck treating corona patient after corona patient. These medical practitioners will go for possibly months without seeing their families. Many will break down from exhaustion, some will die. And the only way to help the situation is to make sure that we slow the spread of the virus to a level where medical facilities can keep up. That means keeping as many people home as possible. The sooner you self-quarantine, the more lives you'll save. What we've seen so far with the coronavirus is that the death rate varies drastically, depending on how prepared the country is. Countries that took extreme quarantine and precautionary measures are seeing a death rate of around 0.5 to 0.9%. Countries where their medical facilities have been overwhelmed are seeing a fatality rate between 3 to 5%. This makes it 30 times more deadly than the flu. Italy, as of Monday, has quarantined the entire country, and this means that all non-essential movement is banned. The Italian doctor mentioned portrayed a devastating picture of the situation in Italy. He said, "I felt that silence was not responsible. I will therefore try to convey to those who are distant from our reality what we are experiencing in Bergamo. I understand the need not to panic, but when the message of the danger of what is happening is not out, and I still see people ignoring the recommendations and people who gather together complaining that they cannot go to the gym or play soccer tournaments, I shiver." This Italian doctor isn't the only one talking about this. I've read testimonials from nurses in Washington, medical workers in Wuhan. They're all saying the same thing. The hospitals are completely overwhelmed, to the extent that they're now denying older people care because they have to prioritize the people who have the highest chance of surviving. I'm going to read you excerpts from this doctor's statement because he said that people need to know what's going on so that we can implement protective and quarantine measures to stop this from happening all over the world, or the damage will be so devastating it will be hard to come back from. He says, "I myself looked with some amazement at the reorganization of the entire hospital in the previous week, when our current enemy was still in the shadows. The wards slowly emptied, elective activities interrupted, intensive care units freed to create as many beds as possible, containers arriving in front of the emergency room to create diversified routes and avoid infection. All this rapid transformation brought in the hallways of the hospital an atmosphere of surreal silence and emptiness that we did not understand, waiting for a war that had yet to begin and that many, including me, were not so sure would come with such ferocity. All this was done in the shadows without publicity. I still remember my night shift a week ago, spent without any rest, waiting for a call from the microbiology department. I was waiting for the results of a swab taken from the first suspect case in our hospital, thinking about what consequences it would have for us and the hospital. If I think about it, my agitation for one possible case seems almost ridiculous and unjustified now that I have seen what's happening. Well, the situation is now nothing short of dramatic. No other words come to mind. The war has literally exploded and battles are uninterrupted day and night. One after the other, these unfortunate people come to the emergency room. They are far from the complications of a flu. Let's stop saying it's a bad flu. In my 2 years working in Bergamo, I have learned that the people here do not come to the emergency room for no reason. They did well this time too. They followed all the recommendations given. A week or 10 days at home with a fever without going out to prevent contagion. But now they can't take it anymore. They don't breathe enough. They need oxygen. Drug therapies for this virus are few. Antiviral therapies are experimental on this virus, and we learn its behavior day after day. Staying at home until the symptoms worsen do not change the prognosis of the disease. Now, however, that need for beds in all its drama has arrived. One after another, the departments that had been emptied are filling up at an impressive rate. The display boards with the names of the sick, all in different colours depending on the department they belong to, are now all red. And instead of the surgical procedure, there's the diagnosis, which is always the same: bilateral interstitial pneumonia. Now tell me which flu virus causes such a rapid tragedy, because that's the difference. In classical flu, besides that it infects much less population over several months, cases are complicated less frequently. COVID-19 can cause a real SARS because it invades the alveoli of the lungs directly. The resulting respiratory failure is often serious, and administering oxygen after hospitalization may not be enough. Sorry, but to me as a doctor, it's not reassuring that the most serious are mainly elderly people with other pathologies. The elderly population is the most represented in our country, and it is difficult to find someone who, above the age of 65 years of age, does not take at least a pill for high blood pressure or diabetes. I can also assure you that when you see young people who end up intubated in the ICU, all this confidence for your young age goes away. And while there's still people on social media who boast of not being afraid by ignoring the recommendations, protesting that their normal lifestyle habits have temporarily halted, the epidemiological disaster is taking place. And there are no more surgeons, urologists, orthopedists. We are only doctors who suddenly become part of a single team to face this tsunami that has overwhelmed us. The cases multiply up to a rate of 15 to 20 hospitalizations a day, all for the same reason. The results of the swab now come back one after the other: positive, positive, positive. Suddenly the emergency room is collapsing. All need to be hospitalized. For others, however, it's too late. The ICU is full, and when ICUs are full, more are created. Each ventilator is like gold. Those in the operating rooms that have now suspended their non-urgent activity are used, and the OR becomes an ICU that did not exist before. The staff is exhausted. I saw fatigue on faces that I didn't know was possible. It's on top of the already grueling workloads they had. I saw solidarity from all of us, who never failed to go to our internist colleagues to ask, "What can I do for you now?" or "Leave that admission to me, I'll take care of it." Doctors who move beds and transfer patients, who administer therapies instead of nurses. Nurses with tears in their eyes because we're unable to save everyone, and the vital signs of several patients at the same time reveal an already marked destiny. There are no shifts or schedules. Social life is suspended for us. I've been separated for a few months. For almost 2 weeks, I voluntarily haven't seen either my son nor my family members for fear of infecting them. I'm happy with some of the photos of my son that I look at in between tears and a few video calls. So you should be patient too, that you can't go to the theatre, museums, or gym. Try to have mercy on that myriad of older people you could exterminate. It's not your fault, I know, but that of those who put it in your head that you're exaggerating. And even this testimony may seem an exaggeration for those who are far from the epidemic, but please, listen to us. Try to leave the house only to do indispensable things. Do not go en masse to make stocks in supermarkets. It's the worst thing because you concentrate and risk contact with infected people who do not know they're infected. You can go there without a rush. If you have a normal mask, put it on. Don't look for FFP2 or FFP3. Those should serve us, and we're beginning to struggle to find them. By now, we've had to optimize their use only in certain circumstances. Thanks to the shortage of certain protection devices, many colleagues and I are already exposed. Some of us have already become infected despite the protocols. Some infected colleagues also have infected relatives, and some of their family members are already struggling between life and death. We are where your fears are. Try to make sure you stay away. Tell your family members who are elderly or with other illnesses, stay indoors. Please bring them the groceries. I don't have a lot of words about the people who, until yesterday, were ready to insult and report us. Both will return to insult and report as soon as everything is over. People forget everything quickly. But with our actions, we influence the life and death of a few dozen people. Please share this message. We need to spread the word to prevent what is happening here from happening all over Italy. So what can we expect in the United States? Depending on how strict we are with limiting exposure to others, we might see 11 million deaths or we might see 1 million. We don't have enough ventilators in the hospitals in the USA to treat the number of people who will become infected. So we need to slow the spread of this. And the USA only has 1% of the masks needed to cover the needs of healthcare workers. If cases keep growing exponentially, which they currently are, that's enough to last for 2 weeks only. Lives are literally in our hands, and the only way to slow the spread without a vaccine, which some are estimating won't arrive until the start of 2021, is by staying at home unless it's essential we go out. Just now, Trump has banned travel between the US and Europe to try to stem the flow of this virus, but I'm not convinced that this is enough. Individuals need to take responsibility and stop going outside themselves. We need to self-quarantine. During a crisis like this, we don't just see deaths from corona, but from all kinds of illnesses where people can't be treated because the hospitals are completely overwhelmed. There are some countries that aren't seeing exponential growth, which suggests that their preventative measures do seem to work. But if people don't take this seriously, don't self-quarantine if they can, and keep calling it overhyped, we don't stand a chance. What preventative measures can you take? Well, there are over 100 companies in Silicon Valley that have implemented work from home measures. If you can work from home, you absolutely should. Not everyone has this luxury, and you're helping protect them by staying home. Yes, you should cancel your gym membership immediately, and that board game night. If you have enough food at home, then stay in. Otherwise, try to go to the grocery store when it's the least busy. Don't let anyone make you feel embarrassed for taking precautionary measures. I'm already in self-quarantine, and if I'm forced to go out, I wear gloves and a mask. There's a lot of FUD around mask usage, but studies show that any type of general mask use is likely to decrease viral exposure and infection risk, in spite of imperfect fit or usage. Now, at 300 cases, Wuhan had already shut down. There are 11 million people in Wuhan. The equivalent precaution would be Denver shutting down after 16 cases. They're already at 18. South Korea, Italy, and Iran had a full month to learn from China, but they didn't. They started the same exponential growth of Hubei and passed every Chinese region before the end of February. Italy provides a chilling glimpse of what's in store for other countries that don't encourage quarantine. As the doctor said, some people are upset because their holiday might have been ruined or their work routine interrupted. But please take some time to think about the healthcare professionals who haven't seen their families in weeks, who are working 48-hour shifts, and who have to make the painful decision of deciding who to treat because they don't have enough respirators for everyone. The longer we can postpone infections, the better our healthcare system will be able to handle this. Every day that you don't self-quarantine, these cases grow exponentially, so every day counts. Please stay safe, be smart, and ignore those around you with their heads in the sand who would have you believe that the exponential growth isn't something to worry about. We can all be doing our part to save lives right now. Thank you so much for watching, and if you found this video helpful, please share it or share any of the article links that I've added in the description below. Get the information out in whatever way you can because people need to take action now. Thanks so much.